So I have 4 success stories, and I'm going to share with you information on the seminar. So if you haven't seen my videos before, my name is Dr. Darren Schmidt. I've been in nutritional practice since 1998. I've been studying nutrition since 1994. I call it hardcore holistic nutrition. And I've been learning a lot of great things over a couple decades now. And I'm going to share 4 success stories just in the last week. So the first guy, he's had anxiety, and he's been pretty homebound for a number of years. And he was having some collapsing symptoms in the last week or two. And he would try to pick up something and get distracted mentally, like brain function-wise, nervous system function-wise. He'd try to grab something and have trouble with it and try to walk at the same time and then collapse. So this is a whole nervous system problem. And I put him on a supplement to get rid of bugs, immune challenges, if you will, inside his nervous system. And he's having a great week so far, and he actually canceled today's appointment because he's doing so well. Yesterday he went for a walk for 1.5 miles. He hasn't been wanting to do that for many years. So I see him in a couple days, but that's a great success. And now related to organisms living deep in the body, deep in the nervous system or in the joints, I have a woman, she's been with me for about 6 weeks. And the first couple weeks I gave her some initial supplements to help get her energy out, change diet, got her off sugar, got her off carbs, and increased the meat intake. And that's all been beneficial. But now her joints, for about 1.5 years, I think she had an infection 1.5 years ago, like a food poisoning, I can't remember, but it kind of froze up her joints, and her clavicles are bigger, and she can't lift her left arm greater than this. Her right arm can go like this, it's slow and it's painful, but her left arm can only go up this high. She can go forward with difficulty, and she can go backward with difficulty. But she's got this arthritis, and the medical doctor gave her some diagnosis, some spondyloarthritis or whatever, I don't remember it is, but the point is the diagnosis means very little if you don't know the cause. So after the first initial weeks of building up her body and getting her diet right, 2 weeks ago I put her on a similar supplement that I was just mentioning for the previous patient. This supplement gets into the joints and it kills bugs. Now, particularly Lyme. Lyme is 80 different organisms that hate the blood. They don't want to live in the arteries. They go into the joints where there's the least amount of blood flow. They go into the central nervous system where there's the least amount of blood flow. So for my first example, it's in his nervous system. For the second example, it's in her joints. She comes back 7 days later and she says she's 35% better, which is incredibly significant. Now, I've been at this practicing nutrition since 1998, and I've had my share of patients with these really bad, horrible arthritides. There's over 200 different types of arthritis. What does that mean? That means that there's different ways to explain the symptoms and different ways to explain the lab tests. But what about solving it? That's the key. That's been the puzzle for so long for so many holistic doctors, of course, the conventional doctors. But I've been working with this company called Cellcore Biosciences. They have fantastic products. The company's only 2 years old, and they just released, about 5 different supplements in the last few months. And these 2 new supplements I'm referring to, they drive into the joints and nervous system, and they eliminate organisms there. So that's been, it's a lot of fun when you're actually able to help people. And the way you help people is with the resources that Mother Nature provides. Okay, I got another guy. He was diagnosed with prostate cancer years ago. He had his prostate taken out. He's on Lupron, which is a hormone therapy, and it drives the PSA down. And when he saw me, when I first saw him, actually back in October, he was gray. His skin was gray, and he was a vegan. His wife was a vegan, and I talked to them flat out about you got to eat meat. So I saw them last week, and they both look fantastic. And they both have color in their skin, rosy cheeks. They have this glow that they've been missing. But back to him, with the history of prostate cancer, he's been on Lupron for 4 years, and now he's still on it, but I put him on a protocol from the book, How to Starve Cancer. And he says that the next day after starting the supplements, he could tell he was feeling better. He could tell it's working for him. He just felt better on the inside, so that's great. So I have another guy, I just saw him 6 days ago. He came in from out of state, and I talked to him on the phone today. This guy has swelling in his legs, his ankles. He's got kidney failure. He's on dialysis due to high blood pressure, and bloating in the stomach and a weird heartbeat. And so I put him on supplements. I told him to start eating meat and focus on meat and eat as much meat as you possibly can. And he said he feels 30% better, which is significant. The swelling is down in his ankles, and when he urinates more. So he's losing that fluid. He's urinating more often, and his heartbeat is back to normal. So no more weird skipping beats, all in 6 days. So this is the kind of healthcare that medicine wishes they're allowed to do. They're not allowed to work with supplements or herbs, or if they think that there's a problem with the diet, they send the patient to a nutritionist or a dietitian who tells them to eat a high carb, high fiber, low meat, low fat diet, low animal protein. It's completely backwards. It's absolutely insane regarding chronic illness. So I have a seminar, if you're a practitioner and you want to jump into the holistic healthcare field, or maybe you've been at it for a while, this seminar is not really for amateurs. It's not for beginners. This is for more like medium to advanced practitioners. We call it ICING. It's me and my associate, Kerry. We've been working together. I think it's 13 years now. It's May 2nd and 3rd in this room, in the office, in this conference room. So you can contact Kerry at her email. We'll put it below. It's Kerry@thenhcaa.com, and you can, that's it. So you can turn it off. So check this out at the bottom and contact Kerry.